All right, so I'm going to talk about how patients, insurers, and suppliers supply and demand care. So we have our patients down here, our hospitals and clinics over here, our doctors, and our insurers, which could be public or private, but in the case of this PPO model, it will probably be private. So what we have is the patients are demanders in all circumstances. They demand insurance coverage from the insurers. They demand medical care from the doctors, and the same from hospitals and clinics, as well as drugs and other services as well. The relationship between insurers and doctors, the insurer demands care for the patient from the doctors, and as well demands care and drugs and whatever else from the hospitals also for the patients. And for the PPO model, which this is, these doctors and hospitals and clinics will be what is called in-network. They are preferred providers. PPO stands for Preferred Provider Organization. The insurer will negotiate lower rates with the doctors and hospitals in this organization, so the patient can get lower rates at those providers as opposed to higher rates at out-of-network providers. In the HMO model, we have doctors, hospitals, clinics, and insurers all in the same firm. This allows the three working together to employ what are called managed care strategies, such as gatekeepers, to keep costs low, and provide one point of contact for patients who demand care and insurance from the firm. So there are two ways that you pay for insurance in the United States, private insurance. The first is through premiums. These are monthly payments to the insurer regardless of the amount of care you use. The second is cost sharing, and there are three types of cost sharing. The first is deductibles. A deductible is a set amount that you have to pay to a provider or to providers over the course of the year before your health insurance starts kicking in. So if I have a deductible of $1,000, I would have to pay $1,000 up to $1,000 for care throughout the year before my insurance starts paying as well. The next two are co-payments and co-insurance. Co-insurance is a set percentage that you have to pay along with your insurance provider for care. So if I have a co-insurance rate of 10%, that means I have to pay 10% of all costs beyond the deductible. A co-payment is similar. Once you get past your deductible, you pay a set rate for a service. So if a co-payment for an eye exam is $20, then I would pay $20 for that eye exam, and the insurer would pay whatever the rest of that costs. So now I'm going to talk about where Americans get their insurance. The number one way is through employers. So the employer buys a healthcare plan or a set of healthcare plans for their employees, and the employees either choose a plan or get the plan that is assigned to them. That's 47.3%. The next three are all government options. So Medicare is care for the elderly over 65. Medicaid is care for the poor and sick. And Medicaid CHIP is care for poor children. CHIP is a children's program. And then we have some more private options. So the ACA health exchanges are basically marketplaces set up by the government where insurers can offer insurance plans that are set values, and the consumers get to choose between those plans in a given market. And then we have the uninsured, which rests at about 9% in 2016, though that it is dropping. And we have a very small percent of people who don't get insurance through any of those methods. That's 1.2%.
So the culture of the United States does affect how healthcare is used. So people in the States really like choice, and so any type of universal healthcare system might not go over well with that aspect, especially since we're a capitalistic society. So an optimal healthcare system would have a balance of the ability to tailor a plan to one's needs and wants, with a desire for high and good coverage. And so with the universal system, people might complain that they don't get to choose the best doctors. They're just given a doctor. Americans also have a tendency to take a lot of risks. So if they're healthy, they're more likely to not buy insurance or to have a really low value plan. And so they'd rather, if they know they're healthy or assume they're going to be healthy, they'd rather not buy insurance than buy a super expensive, high quality plan. And so this can lead to an adverse selection problem. There's also a freeloader problem. So a lot of healthy and wealthy people feel resentful that they're paying for the poorer, sicker population's healthcare, and so that can upset them if they feel that they're paying for someone else's healthcare. But the Affordable Care Act tries to combat this by mandating that everyone has insurance. So even if you're healthy, you still have to have insurance and somehow subsidize the sick people.
So I'm going to talk about some external motivations for having good health. One of them is called Wellness in the Workplace programs, and that is when an employer provides insurance for their employees and then incentivizes the employees having good health by usually financial incentives, lowering their co-payments or premiums, and then the employees are incentivized to have better health, therefore can save money basically on their health insurance. Another strategy is value-based insurance design, where preventative care and healthcare services that are considered more high in value are free or at low cost to the patient. And then our third one is behavioral economic strategies, which use things like lotteries or putting people in groups and challenging them to have better health in order to incentivize having better health and therefore lowering healthcare costs. These are, however, problematic, especially the wellness in the workplace programs, because if an employee doesn't already have good health, that could be a byproduct of worse off socioeconomic status, and then punishing those people financially for not having good health would sort of compound the disadvantage that those employees face.
I'm going to talk about how we pay our doctors now. The first of three is fee for service, where patients will pay a flat fee for each operation or procedure that they go in. The next one is capitation, where each month people will pay a flat fee, and at the end of the year the doctors receive what is left over, which means that they can sometimes try to treat just the healthiest patients in order to receive more money at the end of the year. The last one is pay for performance, which means that the doctors are paid based on the outcomes of their procedures, which can also have negative outcomes because it means they can try to select healthier patients to begin with, and yeah.
So I'm going to be talking a little bit about the pros of our system now that we've gone over, what our whole system's about. So since most of our healthcare is privately funded, this creates, a supply and demand. So the good thing about this is doctors can choose where they want to practice, and also patients can choose which doctors they want to go to, for the most part, that is. With that being said, even though it is a privately funded healthcare system, we do also have a lot of government involvement when it comes to funding research, which is something that really helps on the technological advances that we see throughout our country. And also there's high quality specialist care. So this goes back to being able to choose what physicians you want to go to. You can go to, a normal physician, or there's also plenty of specialists out there. I'm just going to keep it. So now I'm going to talk a little bit about some of the negatives with our system. Going back to the fact that, most of our healthcare is privately funded, this does mean that not everyone is covered, which leads to many people not seeking the treatment they need because they know since they're not covered, they're not going to be able to afford what they're going in for. But with that being said, even with the people that are covered, sometimes they do fall victim to underinsurance. And what I mean by this is, although they may have insurance, they'll go in for a treatment, and insurance will only cover so much, and they'll be left with a bill that's too big for them to foot. Now, continuing in that respect with prices, because it is privately demanded and you got the supply and demand, prices can increase to a very high amount. Prices are driven up by consumers, and since it's consumer-driven industry, healthcare is here, prices can reach a really high price.